My name is Sherry, and I had the gastric bypass surgery in September of 2012. And since that time, I've lost close to 90 pounds. And I feel great. Prior to the surgery, I had been taking several medications for type 2 diabetes. I believe I was on 6 medications for type 2 diabetes. I was on high blood pressure meds, and I was also on cholesterol medication. And I spoke with my doctors trying to find how I could reduce the cost of my medications and improve my health prior to retiring and having to make the decision to live in a refrigerator box or continue my medication. For me, looking into the future and seeing what I wanted to do with my life meant looking back and seeing what was going on in my life. And I was kind of inhibited by some of the things I could and couldn't do. As you age, you lose certain mobility and you lose certain senses and able to perform the way you used to perform. And so walking was a issue, getting around like I used to get around in my youth, and I'm thinking I really wanted to continue to do that and not become a burden on anybody else. So I spoke with my doctor, and she had recommended that I seek out or do some research on gastric bypass, because they had figured out that the gastric bypass could help reverse type 2 diabetic symptoms. So I decided to do some research, and I spent several months looking at that on the internet, speaking with other doctors, and just doing my own individual research. And I was looking at other possibilities to the sleeve and other potential procedures, but the gastric bypass was the one that kept coming back to me as the possible answer to what I was looking for. The surgery itself was kind of a scary process going into it, not knowing, number one, if you're making the right decision, and number two, if how it's all going to turn out. But I had decided in my mind that this was what I was going to go through with, and nobody was going to talk me out of it. And so I limited my access to telling people. I just told immediate family, close friends, and I didn't go to those people that I knew would have a heart attack and say, no, you're not going to do this, because this was something, it was my decision, my body, and my purpose that this is what I was going to do. And the surgery itself I was out, so I didn't have a clue. And it was all in Dr. Ganta's hands, and I figured better him than me. He didn't need my coaching. So I was out like a light, and 2 days later, I think I was home, and I was off work for 2 weeks and went back, and I was fine. It's a little slow coming back, especially when you have a little age on you. So took a little time getting back up to walking and doing the things that I used to do, but I think that I would do it all again in a heartbeat, and it was the right decision for me. Since the surgery, my medications have dropped down to 0. My energy levels are up. I feel more confident. I feel healthier. I feel younger, and I feel like I have probably another 30, 40 years of work left, and I don't like that part, but some things got to give. But all in all, I feel that it was a great experience, and the resolution for me was fantastic. It gave me what I was looking for. Dr. Ganta has been very supportive and answered all of my questions, and I think that the success of the procedure was, a lot of it is to do with the information that they provide you, and in talking with people, I think the success comes from following the instructions and being diligent on your behalf, that if they tell you to stay on a liquid diet for 2 weeks or 3 weeks, there's a reason that you need to do that, and you can't be cheating and doing other things. So they've been through all this with many, many patients, and they know what they're doing, and take and listen to what they're saying, and you'll have a very good outcome. If you are thinking about doing a gastric procedure, then you need to move forward and have it done, because I wish I had done it earlier, because there's so much benefit to it. And I know a lot of people can consider the financial obligations with this, but a lot of insurance companies are now covering this, especially if it's reversing the type 2 diabetic symptoms. And so Dr. Ganta's office will be more than happy to contact your insurance company and find out the requirements that they're looking for, and also what their procedures are. And so he is a good resource for that. And I've spoken with my doctors, my general practitioner, my other surgeon, my endocrinologist, and all of them have highly recommended Dr. Ganta. And it's just, to me, he's the one that you need to go to if you're here in Austin.